Emanuel, a ninth grader hailing from Cuba, was reported to have been born with polyostotic fibrous dysplasia, a disorder where fibrous tissues replace portions of bones, according to the Mayo Clinic's information. The condition was said to have initially affected Emanuel's left arm and leg at the age of 4, but it reportedly became life-threatening during adolescence. It was mentioned that when Emanuel was 11, he observed what he initially thought was a pimple on the side of his nose, which began growing uncontrollably. By December, it was reported to have swollen to 10 pounds, attaining the size of his head. According to the Jackson Health Foundation, a nonprofit group supporting cases like Emanuel's, they conveyed that the tumor had taken over his face and had severely affected the bone structure of his upper jaw and nose. Despite having been paraded to numerous Cuban doctors, it was reported that none were willing to attempt the complex surgery, deeming it too risky. However, with the tumor posing a life-threatening risk due to its impact on Emanuel's windpipe, it was reported that U.S. missionaries who had encountered the boy in Cuba sought to connect him with Marx, chief of oral and maxillofacial surgery for the University of Miami Health System, according to the Miami Herald's report. Marx, who was reported to have learned about Emanuel's case at a medical conference and was said to be one of the few capable of identifying it visually, was reported to have donated his time along with other doctors involved. It was also reported that benefactors raised funds to support the procedure. It was reported that the basketball-sized tumor was successfully removed, and initially there were positive signs post-surgery. Emanuel's eyes were reported to have responded to stimulation, and the muscles on his face were reported to have begun to strengthen. However, it was reported that internally, the teen's health was deteriorating rapidly. Within days after the surgery, it was reported that Emanuel's lungs and kidneys began failing. Despite the hopeful signs observed initially, a grim reality emerged. Robert E. Marx, the lead surgeon, was reported to have announced Emanuel's tragic demise, stating that after he visited Emanuel the previous night and observed a glimmer of hope from pupillary reflexes and facial muscle tone, he was informed the morning after that he took a serious turn for the worse. His condition had deteriorated with kidney and lung failure, and the best of the intensive care unit could not keep pace.